Thank you, Claudia, for the introduction to Serious Games and our project. So I will be focusing on the implementation of the actual project as well as pros and cons and why we would like to lead this project. So our estimated time of completion will be 9 months, about 36 weeks. The personnel we will need to complete this project will be quality and risk management staff, health science librarians, 1 clinical RN educator, 2 IT staff members, 3 university computer science students, as well as university computer science professor and director of student projects. Again, 36 weeks is how long we think this project will take, and the outline will be as follows. Weeks 1 and 2, we expect 2 8-hour meetings with quality management, clinical educator, and librarians to begin developing patient charts based on records we have and additional research of cases as well as evidence-based practice, with some estimated additional 16 hours of work outside of the meetings to prepare and to just get information and research. Weeks 3 through 12, we'll have weekly 4-hour meetings with quality risk management, librarians, clinical educators, university professor, so we can take scenarios and begin building storyboards. Weeks 13 through 14, we'll have 2 8-hour meetings with IT, SU students, university professor, clinical educator, and librarians. Weeks 15 through 24, we'll have weekly 2-hour check-ins and updates with the entire team. Just go over progress and see where everyone's at and combine our information. Weeks 25 through 36, we'll begin implementation and trial with university nursing students. We expect 4 sessions, 4 hours each with the entire team and the students. In addition, we're estimating about 48 hours of additional work per team member to troubleshoot during this 11-week period. The librarians and clinical educators, on top of that, will have about 12 hours of extra work for Captivate 9 and troubleshooting instructions. The supplies we'll need for this project, on top of the resources and expertise of the staff members that we are hiring on, we'll need 6 iPads, as well as Adobe Captivate 9 for the computers we currently have. The total estimated cost to develop this game to complete the project for staff and supplies will be $60,000, $906.24. It's very specific, so that is a rough estimate. But compared to total estimated cost of a hospital for readmission of 1 patient for a clinical error can be anywhere from $30,000 to $250,000 or more, that is definitely a lower cost to have a program that can train our new nurses to be more competent in critical thinking and develop these different scenarios so they can have better patient care and outcomes. So the university nursing students will test the game prior to nursing release. Outcomes will be determined by advancement to different game levels. Once the game is implemented, outcomes will be determined by examining CCU patient data and cases with quality and risk management. We'll be working on establishing measurable criteria as we examine cases, length of stay, readmissions. Our proposed game proficiency levels will be novice, advanced beginner, competent, proficient, and expert. Our target user will be new nurses, and when we say new nurses, we mean a year or newer. So that's when we really want to start them in this program and get them going with the serious games. Our learning objectives will be to increase confidence in clinical issues around more complex scenarios by developing increasing cognition around critical thinking. Our unified framework will be use touchpad to solve quiz-based tasks and scenarios, either via drag and drop, fill in the blank, multiple choice. In this way, we're creating a non-linear pathway to completion. Again, the software we'll be using will be Adobe Captivate 9 and Photoshop is already installed in all of the devices we'll be using. So next we'll have the pros and cons. We'll just lay out the pros and cons of this project. We'll start with the cons. Currently, the librarians, we don't have all the technological skills to develop the game on our own, so we have to outsource a lot of information, as well as we're not as proficient in the healthcare system as a clinical nurse or someone with a medical degree, so we have to outsource that information as well to develop the game to make it realistic and have nurses have the capability of really learning these critical thinking skills in real life scenarios. We've never developed a serious game before, so we don't know if this is a realistic timeline. We've done our research, but again, things can come up, and each scenario in this case would be different. Everyone learns differently, and these devices, the serious game that we're deciding to create here, might not benefit everyone. The pros of our project. It enables the library to be more involved and provide a new resource to our medical education community. It allows for development of skill sets, allowing for the opportunity to track development and skills. So supervisors or managers of these nurses can really track their progress and know their weak areas and their strengths and just really help them become better nurses and better with patient care, outcome, and critical thinking. It incorporates information literacy, especially for resources relating to patient care and evidence-based practice. Supports the collaboration with other departments, as well as supporting the mission of the hospital. The cost of the game development is far less than the cost of just one medical error to the patient and the healthcare system. Why we think our team is best to manage this project. So between Claudia and myself, we have a background in curriculum design and simulation. We have skills working in intra-hospital collaboration, extensive background in utilizing hospital databases and resources. We can manage people with different skill sets. We can work together to carry out common goals harmoniously and really just work to get everything done on time, juggling those multiple tasks. We're proficient in organization, schedule management, and evaluation of skills. And again, our project just really incorporates the mission of the library, which is to help improve patient care and outcomes. And that's what our serious game would do for the nursing staff. It would help to improve patient care and outcomes. So thank you very much for giving us this opportunity to present our serious game proposal to you. We look forward to answering any questions or concerns you may have moving forward. Thank you.